We as nurses have a moral responsibility to provide safe, quality care. We as nurses are holders of the sick and the dying. I ask you to think about how much our patients' lives are worth. Or let's ask the more important question, one that tends to hit home. How much is your family's, your loved one's life worth? Because mine are priceless. We need safe patient limits now. My name is Denelle, registered nurse of 15 years. I have worked from corner to corner in acute care hospital, including areas of the ER, oncology, and medical telemetry units. The critical need for safe patient limit laws in Pennsylvania, for me, is both professional and deeply personal. I actually wanted to start by talking to you today, not as a nurse, but as a mother. A mother of 3, who has 2 children on the receiving end of life-saving healthcare needs that they still require to this day. I have personally watched nurses go through entire shifts without a break, being unable to eat or even go to the bathroom. I witnessed a nurse rushing so much that she almost made a critical mistake on my own daughter. As a nurse, it made me angry, and it made me sad. Sad that this nurse could not safely deliver care because of the confines of her assignment that night. I'm sorry.
It's good. It's okay.
Angry because nurses have for literal decades practiced under the guise that we actually have to deliver care this way. We as nurses have a moral responsibility to provide safe, quality care. We as nurses are holders of the sick and the dying, the helpless, or those who may simply have lost hope. It is our job to care for the whole person, an entire individual, not just the parts of a person that make the most money. Amen. Our profession has a grace and dignity to uphold. And most importantly, we are to do no harm. Nurses personally strive to provide the care we would want for our own mothers, fathers, daughters, and sons. We have been told over and over about the cost of care delivery. Some have spread rumors that increasing staff to meet safe patient limits will force hospitals to go broke. That's simply not true. We can look to examples in other states and to hospitals right here in Pennsylvania where safe patient limits improve both patient outcomes and hospital revenue. But frankly, true or not, these rumors fundamentally ignore the highest priority in healthcare. It's our patients. I ask you to think about how much our patients' lives are worth. Or let's ask the more important question, one that tends to hit home. How much is your family's, your loved one's life worth? Because mine are priceless. We need safe patient limits now. I am honored to stand before you as a nurse, as a patient advocate, and where my pride is as a mother. Alongside all of these amazing elected officials and nurses from across our state, we are calling on legislators in Pennsylvania to do the right thing and pass safe patient limits into law. I will leave you with one last thought, a quote from a leader who gave life and principle to nursing, Florence Nightingale. This is far and away my favorite quote. I attribute my success to this. I never gave or took any excuse. The excuses stop here. Thank you so much for your time.